Tauranga is a beautiful place to live, and initially when I thought about considering coming to Tauranga, I had in mind a place that I can enjoy the beach and enjoy living in such a beautiful place, and I wasn't disappointed at all when I arrived. Growing up in Auckland, you get so used to the busyness of the city, and coming here was such a new, refreshing thing for me. I really loved living here, and as a absolute bonus is that living and working at Tauranga Hospital has been amazing as well. You learn so much from the staff here, not only in the medical profession, but I think that everyone who lives in Tauranga is so well rounded. They all have their own interests outside of what they do at work, and so talking to everyone here, it's been amazing listening to some of the stories and life journeys they've had so far. We were the first group of trainee interns that came to Tauranga Hospital, and the fact that they accommodated us so quickly really amazed me, because there's a lot of new adaptations they need to make and a lot of time that they need to spare to teach us. But no one's ever complained or not wanted us to be around. They've always been very, very keen to teach, and they've been excellent teachers as well. When you're working at the hospital, you might want to consider where you want to live, and for example, the areas around the hospital they're all very easy to find accommodation. Everyone's very friendly, but then other people might say that the Mount Maunganui is a very beautiful place to live, and there's advantages over there as well. It's close to the beach, and there's quite a good social atmosphere, and if you're into going to the beach and surfing and fishing, that's definitely the place to go.
The staff here have been fantastic. They're an amazing group of mentors with their own life experiences, which really drive your interest in medicine, not only as a profession but also as a lifestyle. Medicine is an amazing team environment. You find a sense of belonging working with the health officers and the registrars, and you really get to know the consultants in terms of their journey through medicine, but also how they are in terms of teachers as well. I think one of the tips that I'd say is really explore your interests and passions. Look at the other people in the hospital, look at the registrars, the health officers, and follow them in terms of what makes them good about their job, and learn from them. It's quite different being a student and now taking on the role as a first year health officer. I think one of the things that's really stood out is the level of support you get, but also this ongoing, continuing training. So despite the fact there are hurdles to climb and challenges in front of us, you always feel that you're being supported, and you know that it's within your capabilities of what you can achieve. Well, the team at the clinical school have really made us feel like family. They're your first point of call if you ever get stuck, and they always know the first person to talk to to point you in the right direction. I think they'll really look after any students who come visit.